Yeah, one more important thing, Bruxism. So we are hearing it a lot, especially after COVID and especially in the people who are working from home, even before that, who are in software jobs. What is the impact, and do you suggest any tips to control it so that their teeth last long?
So bruxism is nothing but, in a simple terminology, called as tooth grinding. Tooth grinding happens when there is more amount of stress. That is nowadays, which you see, I think you have dealt with it more day in day out, where
Right,
patients come to you with lot amount of stress, give me
right,
stress
yeah,
relieving medicines, where we control our day to day activity.
right, yeah.
So
What we get is almost 90% of the patients we get when we treat for stress, most of the symptoms are settling nowadays. Yeah, that's the amount of stress everyone is facing in the urban setup.
So very important is the lifestyle. So lifestyle change and cool mindset will definitely play a role in tackling all such a problems, because bruxism is not a thing which just starts within a day or two. It is a lifestyle where the patient is exposed to more amount of stress levels, which leads him to clench mainly the muscles which are there. So he bites onto the teeth in the night. That is called as bruxism continuous. It's called as night grinding. Or other than that, you might see people here and there where when they are aggressive or angry, they try to clench their teeth very tight. They bite, and they try to show aggression. So that is one way of aggression which they show. So stress level management plays a very important role. So to change the body lifestyle or the way of living, we'll get down that on a dentist basis, to prevent that in much amount of damage which happens onto the tooth. A simple device or a simple equipment which we give is something called as night guard. A night guard is nothing but a silicone tray like material, which is nowadays you see materials such as aligners, which are transparent aligners, something called as there are many brands which are showing tooth c and all.
Right, right, yeah.
So it is similar to that aligner itself, invisalign. So it is similar to the aligner, but the material is a bit more softer and will not produce any load or any sort of active movement of the tooth. So it is just a very passive device which you just wear to protect your teeth from the impact. You see the sportsmen wearing that,
Right, right,
the contact sports,
right,
something
right,
like
yeah.
boxing and all. They wear a guard, right?
Right,
So
right,
it
yeah.
is similar to that, but which can be used in a day-to-day basis and very thin. It comes in 2 to 4 thickness depending upon the condition of the tooth, and which can be worn by the patient in the nights along with a proper dental or the dentition guidelines. So the dentist will guide properly to how to wear it and how to use it, so that it doesn't cause much damage to the teeth. And it is just a palliative treatment to protect your tooth from grinding. But again, if it is controlled from the root cause, that is the habit change or the stress levels are compromised, automatically it will come down and it will settle.
Yeah. Thank you, Krishna.